All right, welcome back. I'm so excited, to have Kim Sport here on the show tonight. She is a 3-time cancer survivor. She's the most beautiful woman I've ever met, and her spirit is so vibrant, and now you're going to get to know her too. Thank you so much for being here.
Thank you, Maria, for the invitation.
Every time I see you, this woman inspires me. You always have a smile on your face. You're beautiful inside and out, and you're so active, in raising awareness that, breast cancer kills women, but also for women who have survived, there's options out there for them. So before we get we talk about your your activism with Breastoration, let's talk about you and your journey through cancer and with you and obviously in your family as well.
Okay, well, interestingly, I don't have a family history of cancer, and I came to understand that my cancer emanates from a treatment that I had when I was 6 months old, when doctors thought that children that had an enlarged thymus gland were susceptible to sudden infant death syndrome and other respiratory problems, particularly if they went under anesthesia. One physician decided that the way to shrink this thymus gland was to irradiate the children. And from 1940 to 1960, tens and thousands of people were irradiated. Not people, children were irradiated. I was one of those in 1956. And we found out later on, number one, there wasn't any such thing as an enlarged thymus gland. What they were looking at on x-rays was totally normal. And also that people that had these radiation treatments were highly susceptible to upper body cancers, particularly thyroid cancer and breast cancer. So I was diagnosed with breast cancer in 2001, the first time, and I underwent a lumpectomy, chemotherapy, and radiation, and 5 years of hormone therapy. That's not fun, kind of going into menopause at a very young age. And then I was fine for 7 years and discovered a new primary cancer in the same breast because I had received my lifetime dosage of radiation on the breast with the first cancer. I had to have a mastectomy, and I opted to have a bilateral mastectomy and immediate reconstruction here in New Orleans.
And tell me about, when you do get diagnosed with breast cancer. And, obviously this was 10, 12 years ago, and were what options were there at that time for women when it came to reconstruction and really, having the ability to go from a mastectomy to, I think especially with women, our breasts are part of who we are, and having that fear that, you're not going to look the same. Tell me about your experience with that.
Absolutely. I think the first thing you think when you have a diagnosis of breast cancer is that you're going to lose your breast.
Right.
And
that's yes.
Yes. And even if someone talks to me today and I say, I've had breast cancer, immediately the eyes drop to the chest. Right. I mean, it's just a normal human reaction. I really thought the first time that I was so fortunate to have breast conservation surgery just to have the lumpectomy, and I thought that I threw the kitchen sink at it with going through the chemotherapy, the radiation, and then the hormone therapy. I was just shocked the second time because I just thought I did everything. I felt like my body betrayed me the second time, and knowing I had to go through the mastectomy was a very traumatic experience. On the other hand, I'd been involved in the breast cancer community as an activist for some time, so I was very aware that you could have immediate reconstruction, and I was also aware that you could probably come out looking maybe better than you did before. However, you would lose the normal function of the breast. You can't breastfeed a child. You don't have sensation in your breast anymore. But physically, I would look absolutely normal.
I love that. Just
yes.
and you look beautiful.
Thank you.
Absolutely beautiful. Okay,
Thank
so I
you.
know this journey that you went through and that you experienced the reconstruction. There's some women who are not as lucky as you were
That is
in terms of
correct.
finding obviously amazing physicians, because I know you know some really good breast reconstruction doctors here who've supported you. And let's talk about Breastoration. I know that you were let's talk about the legalities and how you fought for Louisiana to have Louisiana women to have certain rights. Fill us in about that.
Okay. Well, Breastoration really came about between myself and some other breast cancer survivors and my physicians. They were seeing so many women who had never been told once they received their mastectomy that they could have reconstruction, or that reconstruction was an insured option for them. The Federal Women's Health and Cancer Rights Act says that if your insurer provides coverage for your mastectomy, it must also provide coverage for reconstruction. The problem is that so many doctors who perform the mastectomies are not telling their patients that reconstruction is an option. Okay. It's such a serious problem that 70% of all women who are diagnosed with breast cancer are not told that breast reconstruction is a surgical insured option for them.
Right, right.
That's
shocking. Kim.
Yes,
very shocking.
Yes, my doctors, Dr. Frank Delacroix, Dr. Scott Sullivan, have a thriving practice here, and what they were seeing were women who had either not received reconstruction after mastectomy, so they're walking around either with disfigurement on both breasts, or they had had reconstruction on one breast and nothing was done in the other, or the reconstruction technique was so far below the standard, and that these women had to come in and really be repaired another time. So we formed Breastoration to, actually the breast cancer survivors formed Breastoration to educate women about all of their options once they receive a diagnosis of breast cancer, and also to help women who have inadequate funding for the surgery to obtain those surgeries anywhere in the greater New Orleans region.
Okay, and so how are you funded, Kim, to keep Breastoration going and to keep providing, the funds so women can get this type of surgery?
I browbeat people every year.
I know, she's a real go-getter, that's for sure. But I mean, for people that, so it's the fundraiser. Tell us about the event. Does that help you raise money?
That helps me raise money. Our first fundraiser was at the House of Blues, which partnered with us, and for one night, the House of Blues was the House of Pink, and that was our first. And then our second was last year. It just so happened that the American Society of Plastic Surgeons and the National Plastic Surgery Foundation was holding its convention in New Orleans. They wanted to partner with a local breast cancer organization, and they Googled us, found us, and found that Breastoration was really ahead of the rest of the country in creating this awareness for breast reconstruction. So that was that. This year we have this fabulous opportunity in partnership with the New Orleans Film Festival and the Center for Restorative Breast Surgery and my own family foundation, the Sport Family Foundation, are presenting this great film, Decoding Annie Parker. It's a major motion picture starring Helen Hunt. And we're presenting it at the film festival. And this is the story of the geneticist who discovered the BRCA gene. Annie Parker is actually the patient, and then the geneticist was Mary Claire King. And this is their story of how the BRCA gene, I said BRCA, it's the BRCA gene was discovered. And we're going to have this event at the Britannia on Wednesday, October 16th. And for the first time, I believe, in the history of the film festival, they're letting us do a fundraising reception before the benefit screening of Decoding Annie Parker. And then after that, we're going to have a panel of experts, including women who have had breast cancer, doctors who are very, very knowledgeable about the genetics of breast cancer, and then doctors that do the surgeries following the diagnosis.
You know, I love women who get together and do amazing events like
Yes.
this, always very creative and yet for a really great cause. Okay, so we have to, we have to wrap up shortly, Kim, but I want to know, after this event, how can people, because breast cancer is not just the month of October, it's every day of this
Exactly.
year. There's women who are getting diagnosed
Yes.
and women who are thinking about reconstructive surgery and all of that. How do we keep the funds coming in? How can people support your cause to make sure that we have the funds to help as many women as possible?
We have a website, Breastoration.org. Our fund is currently administered by CAGNO, the Cancer Association of Greater New Orleans, so you can go to cagno.org. And I think the main way that people can help is to make sure that if someone that you love is diagnosed with breast cancer, that you help them find out all of their treatment options before they make any decision about what type of surgery they're going to have. In Louisiana, we have a law, one of the strongest laws in the nation, that says that at the time of diagnosis, the physician informing the woman that she has breast cancer must tell her verbally and in writing that all of these options are available to her before anything is done. And our law is so strong that these physicians should write in the patient's chart the date and the time that this information was given to the patient. And so
I think that's
help.
fantastic.
Yes.
That's accountability and
Yes.
and really empowering the patient, but
Yes.
also for the physician to really feel that he's delivered the proper information and to arm the patient to make the right choices for them.
That is absolutely right. There are lots of national organizations that do phenomenal work for breast cancer early detection, prevention, finding the cure. There is no national organization which funds the final stage of breast cancer, which is reconstruction.
Well, now there is right here in New Orleans.
And now there is.
So, okay, so to find, I know I keep talking, we need to take a break,
Yes.
but where would you like this to be in 5 years? Because I know you're going to be around for a very long time and making this as big as ever.
In 5 years, I want to make sure that instead of 7 out of 10 not being told that all of these reconstruction options are available to them, that 10 out of 10 women are told, just as a matter of fact, a matter of policy, a matter of standard procedure by their physicians, that there ought to be a team of surgeons involved in making whatever determination there is regarding the type of breast surgery that they're going to have. And I think that we're on the way. I think
you're on the way, and you're going to make it happen, Kim. Thank you so much for being here. And we're looking forward to that amazing event. All right, everybody, we're going to take a quick break, and we'll be right back.